Hi guys, Peter Dingle here, and welcome to the Sibo solution. Sibo stands for small intestinal bacteria overgrowth, and I'm sure you know that. Now, this is one of our many solution-based programs. All of the information on our membership program is really designed to help people fix the problems. So understanding what's going on, the background to it, the science of it, and literally what to do to take steps to fix the problem. And all these problems are fixable. So it's really a matter of just saying, okay, let's get started. We've got a reflux solution program. We've got a program already set up called Gut Secrets, which is all about basics of healing the gut. And I recommend everybody, even before you watch this program, you have a look at our Gut Secrets, Gut Solutions, Gut Healing presentation. There's a huge amount of information which relates to SIBO and lots of the other gut issues. And I'll talk about how they all relate together. So that's particularly important for you to have a look at that before you get into this part of it, okay? On top of that, we've got a kids gut health program and so many other bits which link into that. We've got a program all about toxic chemicals, in particular personal care products and how they link into the gut, dysbiosis, what causes the problems in the gut microbiome. So much information, and not just information, but tricks and treats to be able to solve the problem. So let's get into the SIBO solution. It's pretty easy. The first thing is my disclaimer. Have a look at this, read it, and essentially, I'm not a medical doctor. So what we're after here is uh, I'm going to give you the information. I'm going to show you what works in the science and what we've heard works from all the information we gather in from all the people. You've got to remember, every year we actually do about 90 or 100 talks. So we're talking to about 10,000 people in these interactive sessions afterwards, hearing what the issues are, what works, what doesn't work, and so on. So we continually feed that back into our programs, which I should say we also update. And so at the end of each year, we'll be putting in little inserts, whatever we find in the science. And all our programs are science-based. To do this one alone in SIBO, we've reviewed over 500 studies. Now, there are more than that out there, trust me, but we've reviewed over 500 studies. And you'll see that as we go in. On some of the slides, I'll put some of the references if people want to track it down. Now, one of the things about my presentations, I will give you too much information. And I don't apologize for that, because there are people who really want to go in there and get the real nuts and bolts. And if you understand these nuts and bolts, then you can actually go and develop your own program, which is what we're on about, which is what we're trying to do, empower people to understand the science, to be able to take action, not just, oh, okay, here's what Dr. Dingle said, here's what Peter said, go out and I'll do it, because there is no one solution, which is what I always talk about. I'll show you that later. But here we are, part one, understanding the problem. That's what we're going to do. We've got 4 parts to this program. And the second one is the mechanisms and the causes. The third one is the science behind the solution. So what shows up in the science to fix the problem? And then part 4, and this is a typical strategy I use in all my presentations, part 4 is the SIBO solution program. What can you do? And it's very important to understand that SIBO is not one condition. It's for everybody. It's different. And there are lots of different mechanisms causing it, creating it, lots of different mechanisms underlying it. And so what we're trying to do is get back and give you the fundamental principles. For example, we know that all of the gut issues, whether it's reflux or SIBO, inflammatory bowel disease, or it might be even dental decay, links back to underlying conditions. And so what we try to do is give you information on how to rebuild the whole digestive system and rebuild your health to create ongoing. So I'll give you an example, and I'll highlight this right at the end of this session. But if you've got SIBO and a lot of people go take antibiotics, great, you might get short-term relief. And that's what the studies show, because what they're doing is not fixing the underlying conditions that might be linking back to the nervous system or even your immune system, or some other part of your body. For example, it might be your pancreas or your liver. So what we do is take the whole organism approach and come up with a balanced program for you to be able to resolve and say, okay, this is what we're doing. So it's really important to understand the underlying causes of it. Now, you can skip it if you like, but at the end of the day, you have to come back and look at parts 1, 2, 3, not just go to part 4, because parts 1, 2, 3 put it all in perspective. And if you can understand that, as I've already highlighted, then you have a way of saying, okay, I'm going to adopt a slightly different strategy, and I'm going to do it this way because I think this is where I'm coming from. For example, if you've been on protein pump inhibitors, which are the drugs they use for reflux, then you're going to have different underlying causes than if you've got irritable bowel or let's say diverticulitis or Crohn's, another condition of the large bowel. So there are understanding your mechanisms and causes and contributing factors means that we can actually get onto it. And this is my slide I put up with all of it, showing you, look, at the end of the day, you've got your immune system involved, your nervous system, your hormone, which is your endocrine system, and it all links through inflammation, oxidation, and metabolic dysfunction. So what we're trying to do is get the body back into balance. First, the digestive system back into balance. Second of all, we're trying to reinitiate, re-kickstart your overall body health and wellness. And we do this through our program, looks at diet, environment, attitude, lifestyle. And again, I'll highlight this. You cannot try and fix your gut issues without looking at your attitude. Stress, emotional issues can play a huge role in all these conditions. They can shut down digestion, as it does diet and exposed to environmental chemicals, or even over-exercising in lifestyle. So all of these things are really important. I actually call them the deal: diet, environment, attitude, lifestyle, the dingle deal, of course. And I use this as a way of bringing it together in a holistic way that people can understand it. But that's why in our programs, we have so much success, because we tackle the whole systems. So what is SIBO? I'm going to go into this, and most of you would understand it. It's a small intestine. There's a little picture. When you look at that picture, you'll see the stomach leads straight into the small intestine, the duodenum, and it wiggles down. It's called the small intestine, although it should be actually called the long, skinny, wiggly, squiggly intestine, because it's much longer than the large intestine. It goes into the jejunum and the ileum, which are the final part of the bowel, which then leads into the large intestine. You'll see a little bit of this and you'll learn the terms. It's not that critical, but to understand there are different parts of the small intestine. And in fact, you can break it into many, many smaller parts than here, because SIBO can occur in different parts of the small intestine. And on top of that, different manifestation of symptoms in different parts of your body. So understanding a little bit of the anatomy gives you a little bit of a background there. So first of all, understanding there are some specific microbes when it comes to the gut and your small intestine. So not all microbes in your bacteria and fungi and viruses and so on are bad in the small intestine. In fact, there appear to be some microorganisms in there that we should have that help with digestion, in particular, the digestion of fats. But what SIBO is an overgrowth of that. And we've got a number of mechanisms that I'll talk about later on, but mechanisms like we pump in, our body pumps in sodium bicarb in the small intestine to change the pH, to literally alter what can grow there. And it says, basically pumping in sodium bicarb says, don't let the microorganisms grow. Then we've got some more. Bile has a pH, which stops the microorganisms growing. And bile also has some antibacterial properties. Now, there's 2 or 3 or 4 other things that basically say, okay, microorganisms in the small intestine, you can be there, but don't reproduce, and don't reproduce too much. And as you go along the small intestine, they start to increase in number. And of course, what's happening here is if you've got some dysfunction in there in the small intestine, what happens is the microorganisms start to breed. Now, the problem is getting too many of the microorganisms, and you'll see a lot of this later, start to produce, but there's not much oxygen down there. So what they do is fermentation. That's anaerobic. And so they have fermentation, particularly, basically, they start fermenting all of the ingredients, but particularly of the carbohydrates. And these carbohydrates, when you ferment them, you produce hydrogen, methane, and carbon dioxide, and that's a gas. And at the bottom end, literally, it's too far up to go down and cause a little fart, and it's too low down and blocked with your stomach and a little sphincter in there to come up and a burp. So the gas has to go somewhere. And of course, it's not designed to absorb many gases, but a little bit some will be absorbed into the blood, and the rest will create that distension and the pain and the other problems, the gurgling or the awkward feeling down in that area. A couple of terms I'll touch on quite frequently. Digestion is when our body breaks down the foods, so breaks our carbohydrates down, and it doesn't end up producing anywhere near the amount of gas or byproducts. So we're getting what we want, and in our small intestine, your pancreas pumps in enzymes to actually break everything down, your fats, your protein, and your carbohydrates. So it's breaking them down. And that's what we should be happening, digestion with chemicals, digestive enzymes from our system. We'll have some from our saliva, some from our stomach, and of course, the small intestine specific ones. Fermentation is a microbial breakdown and doesn't normally occur. In other words, it is occurring in the presence or the absence of oxygen and produces a lot of gas. Now, that process does actually occur in your muscles, and you know what the problem is when you get a short burst of exercise, for example, and you might end up with a little bit of muscle soreness, which is caused by the lactic acid buildup. And as a result, you end up with sore muscles and you have to repair it. Now, anyone doing exercise knows all about that. And that's a similar process to what we're talking about in the small intestine. So what are the signs and symptoms? And here I'm breaking it down into different parts of the body, because it's really important to understand that it's linked to different parts. And if you understand that, you can say, well, this is where it's happening in my body, what's going on. And therefore, now the first one is obviously abdominal pain and or discomfort. So bloating, common flatulence, abdominal distension, loose motion. So you've got some form of diarrhea, but sometimes you can actually end up with constipation. So knowing which one your state you're in, and some people may even fluctuate between the diarrhea and the constipation, but diarrhea tends to be the most. So what we want to do is deal with that diarrhea in the process as well. And as a result, so you've also got often associated with Sibo is immune deficiency illnesses, conditions which you'll know of, and frequently something called metabolic acidosis. And this is the elevation of something called D-lactic acid, D-lactate in the blood. And as a result, so that's produced in the small intestine, gets through in the blood and causes lots of problems, which I'll mention later. And some really simple strategies to reduce that, by the way. So we've got other signs and symptoms. One of the problems with the D-lactate or the D-lactic acid is that it can get up to the brain and affect the nervous system, and as a result, you end up with symptoms of brain fogginess, mental confusion, impaired judgment, short-term memory problems. And it's interesting that at many of my talks around the country over the last 5 years, since we've been talking about gut health specifically, people have come up and said, look, I can't come, I can't, or they've contacted me and said, look, I can't come and say, I can't focus, I can't even be sure. These are obviously severe cases, but people are really under stress mentally and emotionally and don't know how to deal with it. So one of the things that I do is a couple of quick strategies. Here you go, try this. And we find actually, and you'll see that later, we find that it can resolve the problem enough to give them some comfort to be able to then take the next steps. So it's also important to note that in this case, as I've listed down there, brain fog, and I don't have to describe it because you all know a little bit about that, but brain fog also occurs frequently in fibromyalgia. And at this point, I should say that there appears to be a very close link between Sibo and fibromyalgia. So with some people I'm working on in terms of the science behind fibromyalgia, one of the first things I say is have a look at Sibo, small intestinal bacteria overgrowth, and see if we can link that in. because they have the brain fog, and they actually have many of the signs and symptoms too. So brain fog was reproduced in 66% of subjects who had SIBO, so we can see that. And that D-lactic acid, D-lactate I mentioned earlier, is very common in, or probably the main, if not the only cause of the brain fog, but we'll work on that with the information. Now, the other signs and symptoms, because a lot of people say, okay, so that's it, I've got it. Well, there are lots of other signs and symptoms that you can pick up to say, okay, this is SIBO, this is IBS, this is, maybe silent reflux. And here, with SIBO, your small intestine is meant to actually be absorbing all the nutrients. That's the main place for absorbing all of your nutrients. The large intestine and the end of your small intestine is a lot more for the breakdown, the fermentation breakdown, and a lot more of the fermentation and digestion and absorption of some of the other nutrients. But up in the small intestine, it's particularly your vitamins, for example, your minerals, and those basic nutrients that we all hear about all the time is necessary. And what happens with SIBO is you can actually get the destruction of your little microvilli and villi. Villi are the little hair-like features in your, all through your colon and so on, that increase the surface area of absorption. So if they're getting destroyed, it's actually destroying the surface area for absorption of nutrients. So there's a lot of malabsorption, maldigestion signs and symptoms in chronic SIBO, which is really important to know. And one of those obviously is weight loss. Some people say, hey, great. No, you don't want to get to there this way, trust me. But weight loss is a sign and a symptom of this also. You can also have poor digestion and absorption of your fats, proteins, and carbohydrates as a result. And so that can end up with when you have the poor digestion of the carbohydrates, you have the fermentation, which produces the gases. Fat malabsorption can lead to things like what's called fatty liver. And the problem with protein not being digested in the stomach and digested in the small intestine and absorbed is you can get some protein fermentation byproducts. And one of those is called, or your nitrogen products, you get urea formation, but you'll also get a group that are well-known cancer-causing agents called nitrosamines. And we don't want those in the digestive system, but because they're not being digested in the stomach and or the small intestine enough, the fermentation can sometimes produce these as a byproduct. Fat-soluble vitamins, because we're not absorbing fat properly, you've got your vitamin A, vitamin D, not so much vitamin K, but also vitamin E, which may not be absorbed properly, digested and absorbed. See, these vitamins and minerals and so on are all linked in together and in a matrix of food. And you have to break the food apart, first of all, in your mouth, stomach, and then small intestine for the parts to be released. And so you may be deficient in some of those fat-soluble vitamins. And one of the things which we'll recommend later is obviously looking at your vitamin levels. Vitamin D in particular, by the way, obviously you get vitamin D out in the sun, and I tell everyone, get out in the sun. You need a good half an hour at least in the sun, and if you've got a darker skin, you need longer. So all this fear about skin cancers has driven people inside out of the sun. Don't sunburn, but get out in the sun to get the vitamin D. It's the most effective way of it. It's not a real vitamin as such. Anyway, so we need those fat-soluble vitamins. We also find that some of your B vitamins are taken up by the actual fermentation microorganisms. So the bacteria or the fungi who's causing the fermentation are using it, in particular vitamin B12. And vitamin B12s have huge amount of uses and needs around the body. So we may need to supplement with B12, which again, we'll talk about later. Minerals like iron and calcium, all minerals in essence have to be, again, broken from that food matrix to be available, to be absorbed into the body. It just doesn't go in and go through the little holes. It has to go into the body and then move through what's called osmosis, and it will be actively transported through into the blood where it can get to all the places. And for that to happen, it has to be in the form that's absorbable, usable, so it has to be fully digested and then absorbed. And what we find, because of the damage done in the microvilli, the part of the small intestine where the absorption occurs, you can end up with deficiencies, and most of it has been demonstrated in terms of bone and calcium deficiencies. So the message here is one of the first things you can do if someone's I always tell people one of the first things they do when they tell me, my doctor said I've got osteoporosis. Remember, osteoporosis is a process. It's not a disease. However, how to get the calcium, improve your digestion and absorption, making sure your stomach acid is high. We'll get into this later. And absorption and everything is going on in the small intestine too. So we have to make sure it all works together. Sibo is also very common in children. And we see this. There are lots of studies around the world showing that Sibo is common in children. It's more common in children who have gastrointestinal complaints, pain, chronic pain, which I'll talk about in a moment. But it's also linked, particularly in developing countries around the world, with worldwide malnutrition. It's one of a major cause of malnutrition, leading to stunted growth and lots of malnutrition symptoms. Even though they're taking the nutrients in, if the absorption part of the small intestine isn't working effectively. So it's very prevalent in underprivileged countries, in the poor people in those countries, as a result of various other factors. And by the way, it's prevalent, as you'll see, in richer countries, in the more obese people. So Sibo was identified when they did a study of a group of children 19 years and under, 31%, 19 years and under who had gastrointestinal complaints. So stomach aches and pains, diarrhea, constipation, anything like that. 31.5% actually reported Sibo. And I'll tell you how they do it later on. I'm sure you know it's a breath test that come up. So we know that it's very prevalent around the world, and we know it's prevalent in people who have maldigestion issues. Now, it's also prevalent in the elderly. Now, why I'm putting this up is because if we understand this, we can say, okay, you may not be elderly, but there are a lot of people in aged care facilities who are extremely poorly nourished. And one, I don't believe they get good food anyway with the nutrients, but two, if they can't absorb the nutrients, if they are getting it, it's useless. And no one's talking about this. They're saying, oh, okay, we're giving them this mixture of protein powders and nutrients, but if you're not absorbing it, and you may find that people who have Sibo are quite reluctant to actually eat. So there's a lot of weight loss, which is what you don't want in the elderly. So it's probably the most common cause of malabsorption and poor nutrition in older adults. So something, again, nobody's talking about, and yet we know it is. Sibo in the general population has been shown in population of around about 2 to 6%, although one study suggested 20%. I don't think it's that high. However, what we do know is 2 to 6%. Now, that's a lot of people, and these are the ones who have actually been breath tested, and there are lots of studies around there showing that. Now, for people who have bloating, gas, and pain, the typical symptoms that I talked about, Sibo was reported in 33% of the patients who had that, who came in and did the breath test. And I'm going to mention a few other issues that were reported in there, which will link with Sibo, and I'll show you the differences and the relationship later on. But fructose intolerance was in 34% of the patients. Lactose intolerance was another 44%. And this is giving you a little bit of a hint already, okay? Isn't it? If lactose intolerance in 44%, wow, maybe I should get off dairy. Maybe I should just try that. But we'll talk about that later when we get into it. And you see some of the science behind it. And what's called hypersensitivity or visceral hypersensitivity, where they just seem to react to certain foods. So we're not talking fructose and lactose here. We're not talking the big ones, the big players. And we're talking about other food substances that they may react to. So we see that increasing. Now, why are these numbers so high? In Western society, I believe, no doubt, big driving forces are the medications I'll talk about later, the foods we eat, the processed foods we eat, and of course, issues such as stress and that play in there, and our exposure to toxic chemicals, which is the deal I mentioned earlier. So in Sibo patients, we find, in people who take proton pump inhibitors, which are the drugs for reflux, after a couple of years, something like 50% of the population have Sibo or test positive for Sibo. Now, that's really important to understand because it's already suggesting the cause may be linking back to the stomach and the stomach acid, because these proton pump inhibitors, which I'll talk about later, you would have heard of them as Nexium and so on, are changing the whole ecological terrain of the stomach, and therefore the small intestine and the large intestine, it all follows on. And this is a major side effect that's ignored out there. They also find out something like 25% of patients with IBS have, in this one study, IBS, have Sibo as well, and around about 6% of healthy controls. So when they went out and they surveyed an equal number, or relatively equal number, they found 6%, that 2 to 6%, that's where that comes from, that I mentioned earlier. We also find out that something like 17.1%, 17%, in one study, they showed up positive breath tests for Sibo, and in healthy subjects, it was only 2.5%. So it's showing that what we eat and our lifestyle factors that lead to obesity may be a contributing factor for some individuals, which is, again, giving you a little bit of hint of, okay, where can we do, what can we do? How can we treat it? Well, one of the simplest things, if you are overweight, I really suggest you look at the program I've got on the membership on weight loss. It's a holistic program. And it gives you the signs, all the information on solution, because it shows how you can lose that weight. If you don't need to lose much, still have a look at it, because it's all about rebuilding your health, and it might even help you lose those last 5 or 10 kilos. But that's why we look at this whole approach, a whole body approach. In another study, 72.2% of overweight children has a positive test for that they had a breath test, a positive breath test, and were considered suffering from Sibo. So we've got huge numbers when it comes to gut conditions, obesity linking in with Sibo. So if you're got gut conditions, you've got gut pain, any of those, any signs or symptoms in the gut, and you're obese, then it seems to be somewhere in the 70% range that you're going to have Sibo. Chronic abdominal pain is a huge player in pediatric visits to hospitals and to doctors and to hospitals and clinics around the world. It's 25%. It's really, really large. I've already done a session on kids' gut health and so on. And in some cases, it makes up almost 40 or 50% of visits to clinics. So the message is, if we can resolve these chronic abdominal pain issues through some common sense, we're going to save a lot of money, a lot of pain and suffering, of course, in kids, but also a lot of money for you and the economy, which is what we're trying to do. We're trying to get this message out there. And they actually found that of those 25% who go there, which is a large number, about 91% prevalence of abdominal pain and breath testing for Sibo. So we know it's a large percentage now. They also found 35% of children who had no chronic pain also reported going to the hospital. So there is a little bit of an overlap there, but showing that chronic pain in kids. Now, a little bit of background, because you've already given you the whole idea of what this issue is. The small bowel, which is what we talk about, the small intestine, which then leads onto the large intestine, is 19 foot long. And the microbes can be anywhere along. They start off in a lower number and they increase as they go down. The main function of the small intestine is digestion and absorption. I should say the main functions of the ancillary organs is to help that, and also to help control microbial growth. There is a half a dozen factors in there that literally occur in the small bowel, the small intestine. And remember, it's very different as it changes, as it moves along that 19 feet. I should have put meters, shouldn't I? Oh, well, I'll have to work out. And here is another picture just to get the idea. The colourful blue and green part is the small intestine. And you've got the duodenum, which is the beginning part, and then you head into the jejunum and the ileum, which are the other parts, and they change as they go down. Now, when we look at it from a perspective of understanding what's going on there, you can probably break it into another half a dozen parts. So we'll say the beginning of the small intestine, the beginning of the duodenum, and it alters all the way along, but you'll get the concept. Now, how do we test it? Most people here probably know already. You're thinking, hold on, I've talked about breath tests, I've got the signs and our symptoms. Well, if you know that, you already know a lot more than most of the clinicians out there. In fact, by the time you finish this, you will know 99.9% more about Sibo than anyone else out there, even the health professionals, because they don't have the time to focus on that. They often focus in one area and they're practicing. I don't practice. I'm not a medical doctor. I'm a researcher, and my passion is to gather all this information. So at the end of the day, the gold standard for detecting if you have SIBO is the breath test. And the breath test, there's a couple of different types that they do. And you've got the LBT, you'll see this mentioned, the BT just stands for breath testing. And why we do it as a gold standard, you can get better results from doing some clinical studies where you take patients aside and do some testing in the intestines. Why this is so good is because it's non-invasive. It doesn't take long, the results are available quickly, and it gives you a pretty good indicator, although not 100% perfect in terms of the results, getting the right information. However, the two types of tests, the LBT, which is the lactulose, and the glucose. Now, the lactulose is typically the byproduct or the product in terms of lactose, as lactose is a sugar that you get in dairy products, and glucose obviously is the sugar that you get in all your fruits and veggies and everywhere else out there. And the combination of the two appears to be more effective. So what it's saying here in these studies, and dozens and dozens and dozens of studies, this is the one I'm talking about here is a 2020, January 2020 study. And the studies, by the way, relate back to, I found the first ones in the, well, a mention of it in the 70s, first studies late 80s, 90s, and it's the last 5 years where there's so much information coming out there. And so they basically say the best test is the one where you do the glucose and the lactose at the same time to get an idea of what's going on. But we can refine that as we go on. And when it comes to treatments, most of I apologize, you've lost it a little bit up there, but it doesn't matter, because at the end of the day, if you want to follow any of this through, you can follow the references that I'll put up there straight away. You can't click on them here because it's a recorded document, but if you just photocopy that, put it up, do any of the search items there, and these articles will come up. Very easy to trace them on Google Scholar or PubMed or just Google. And as a result, what the studies show is generally in the studies on kids and adults that using antibiotics, and the main one you can see up there is called rifaximin. And I don't know really the names, show that they can be beneficial in the short term, but in the long term, what they do is after the treatment has gone on, that they end up with most of the conditions coming back. So antibiotics are a short-term treatment, and the problem with antibiotics is they may have even caused the problem in the beginning. And rifaximin is one that's very exclusive, and again, if it's not dealing with the right type of SIBO, then it's not going to be effective at all. And again, over a period of time, they show that the effectiveness gets less and less. Why? Because they're not treating the underlying cause. So you may kill the bacteria or the fungi, other products in the small intestine, but if you're not changing or altering the conditions at the same time, then you're just leaving it open. So it's like clearing the ground out in a paddock, getting rid of all the weeds and so on. But at the end of the day, the weeds will still come back, because guess what? You're not putting something there. You're not fixing it. You're not changing the watering and the light and all those things that are altering it. So coming back, I want to emphasize this, the program we have is a total one. Why? Because when you look at all of these diseases of the gut, they're all dramatically increasing. We have diseases of the esophagus going up at 500%. SIBO, they don't have numbers on SIBO, but it's probably in the vicinity of 3 to 5 or 600% a decade now. All of these other diseases I'll list down there are going up in huge rates. They are the fastest growing diseases in the world. And a lot of people say, oh, well, wonder why. It's so bloody obvious. It's the medications, particularly the antibiotics and proton pump inhibitors. It's the junk food and processed foods, and it's all those other little factors that come in, e.g. stress and environmental things that tip us over the edge. So when we're dealing with SIBO, you have to understand all these other conditions as well, which is what I talk about in my other presentation. So when you finish this and you haven't looked at the one on reflux, please go and have a look, because guess what? It links into all of these conditions. And remember, they're all going up dramatically. And if I just give you some examples how they're all linked in here, and there's a lot of studies. IBD stands for inflammatory bowel disease. Now, this is a very serious condition that frequently will lead on to having a little bit of your bowel removed. And the odds of having Sibo in IBD is 9.5 times controlled to people who don't have IBD compared to people who don't have. So some of the other studies are 10, but it's essentially somewhere between 5 to 10 times the risk of having Sibo if you have inflammatory bowel disease. Now, there's another condition called IBS, which is irritable bowel syndrome, which is kind of, it's not a definitive disease. It's a list of symptoms related to diarrhea. And there's a lot of crossover between IBS, IBD, and Sibo. And so if you can understand that along the way, and here are lots of studies, and there are dozens and dozens and dozens of studies linking these together. So which one are you going to treat? Well, I think we treat the whole system together. That's why. Then you've got celiac disease. Overwhelming research shows that celiac disease is probably, well, in a lot of people, also linked to Sibo. And even when they go on a gluten-free diet, which is what celiac is, going on a gluten-free diet, they actually see that the symptoms of Sibo are still there. So they've still got the symptoms. So there's a link there between Sibo and celiac disease. And so if you've got celiac disease, look into the fact that you might also have Sibo. And if you've got Sibo, look into the fact that you might have celiac, or even something called gluten non-celiac sensitivity. So you've got something that you're reacting to the gluten and or some of the other products in wheat and so on. So the message is they're linked together. Now, the same things, there are lots and lots of other conditions out there, and I'm not going to go through them all, but 25 to 40% of rosacea patients, and you'll know what I'm talking about. It's a skin condition that has liver and gut conditions, a whole raft of conditions out there linked with rosacea, and 25 to 40% of rosacea patients have or had Sibo in this study. So again, a lot of people will want to treat the face, but if you're treating the face, particularly in the case of giving anti-inflammatory oils and ointments and treatments and so on, can exacerbate the Sibo. So my message is, if you've got rosacea, fix the gut first, and Sibo may be a condition linked with that, and vice versa. Rheumatoid arthritis. Now, the two conditions I've got in there, you see the RA with hypochlorhydria and achlorhydria. They're basically saying low stomach acid. So we know if you've got low stomach acid, 50% of people with rheumatoid arthritis who have low stomach acid have Sibo. Now, we already know that the drugs that contribute to low stomach acid production, the proton pump inhibitors, lead to Sibo. We also know, off the topic a little bit, but people with rheumatoid arthritis, people who take the drugs, the proton pump inhibitors, also have an increased risk, dramatic increased risk of having rheumatoid arthritis. So we can see it's all linked in here. And one of the things we're going to try and do is re-establish your whole gut pH, I'll talk about later. Systemic sclerosis is another condition characterized by inflammation, fibrosis, microcirculation, internal malfunctions, etc. And we find the prevalence of Sibo is 39 to 43% in patients with cystic sclerosis. Hold on, wow. And most of those people don't know that. And so if we can understand it and we can work backwards and forward both directions, that's why we'll have much more success in this program than anything else out there, because we look at the whole system. Chronic prostatitis, so inflammation, chronic inflammation of the prostate gland, gentlemen, had positive LBT tests, so lactose breath tests, lactulose glucose breath tests, and so it's very common in lots of conditions related to pancreas, including pancreatic cancer. It's linked in with diabetes type 2, fatty liver. cardiovascular disease, arterial stiffening, coronary artery disease. All of these we find high levels of Sibo compared to controlled populations. So again, we need to treat the whole organism, the whole body, the whole digestive system to get a result here. Non-alcoholic fatty liver and so on. Again, all of these conditions linked with it. Obesity is intimately linked with it. So SIBO was more frequent in obese patients compared to non-obese patients who had gut conditions. All of these things show, okay, let's go back. In children, the same condition occurs. What we want to do is understand that while we're fixing the SIBO, we're going to fix all of these metabolic conditions. This one's really important because some of these conditions may be a cause of SIBO and some may be a byproduct of SIBO. Now, in the case of poor digestion in the small intestine, SIBO, then it may be causing fatty liver and diabetes type 2 and arterial. There may be a link back. But in this case of hypothyroidism, there is a very strong link both ways. In fact, hypothyroidism, which is a low active thyroid, has a big impact on causation. So it's a role, someone who has hypothyroidism, very likely to have SIBO. And as a result, what we want to do in fixing SIBO is also improve the functioning of the thyroid. So you can understand that, can't you? Because if you can get rid of the bacteria and the fungi, but if you're not getting the thyroid to function and the nervous system and all those other things to function at the same time, it's going to come back. So, and again, anyone with hypothyroidism should be looking at fixing SIBO because it's a two-way street. And you'll see lots of that later. Experimental show, I put up pancreas before, inflamed pancreatitis, pancreatic cancer, very, very closely linked with SIBO. Now, you've got to understand that the pancreas is intimately linked with digestion. In particular, you've got sodium bicarb, which I'll talk about later, and the digestive enzymes. And we know, for example, that the more processed foods that you eat, the larger, the more greater inflammation in the pancreas, which means it gets harder, well, at least in theory, it gets harder to produce the enzymes, so it goes into a state of inflammation. So we know in all of the pancreatic conditions, pancreatic cancer, inflamed pancreas, it's linked in there, and it's a two-way street. And we also find that the SIBO microorganisms, so the microorganisms in the small intestine, are also found in the duct going back up to the pancreas and in the pancreas. So that's why there's a two-way street in there. And restless leg, I thought I'd put this one in as one of the mental health conditions out there. I'll give you I've mentioned the other ones when I put up the stuff about D-lactate, but they actually find that a lot of restless leg. So this is chronic. It's not the occasional person who move their leg around. This is literally an autoimmune condition linked to gut and a whole raft of other issues, and it's definitely linked to SIBO. So it may be an indicator if someone has severe restless leg, then they may have SIBO. Get the idea of how you can link back both ways and understand it. Now, I did all that research and then I came across this review of all the studies. It's a little bit old, but it basically shows all of the different diseases and the studies. The ones in the far right there, the blue ones are the studies. So in the references of this journal, and the bottom, the journal is listed there. So people can always check up. That's what I'm doing. Unfortunately, most clinicians speak to you as, well, you don't know anything. Come on. If you go and share this information with clinicians, they'll go, wow, why don't I know it? And because at the end of the day, most clinicians don't have an opportunity like I do to research every single day. So they're the studies in the blue. The middle column, which is the numbers, show that healthy controls, somewhere between 0 and 20%, have SIBO. And I think it's closer to 0 to 6%, as I mentioned earlier. But you've got celiac disease, connective tissue, Crohn's, all those ones I've mentioned, and lots more under there. So again, the ones I showed you earlier, the ones that I found, then I found this one. And at the end of the day, we know that it's linked in here and it can give you a bit of an understanding. So if you have chronic fatigue syndrome, there's a fairly good chance that you're going to have SIBO. And the same with fibromyalgia. In fact, the fibromyalgia, you see that 93%. That was conducted in a couple of studies done in the early 90s or 2000s. I think by a researcher called Pimentel. And two studies, or a couple of studies he did, showed that. And there's been virtually none that I can find since then. So we have to assume fibromyalgia, chronic fatigue syndrome, are closely intertwined in there with small intestinal bacteria overgrowth. So I've given you a huge introduction, overwhelmingly. I know there's a lot to take in there. And you're probably saying, wow. Well, look, the great thing is because you're in the membership program, you can go back and look over it. You can go back and review it, because it is so important to understand the links in there, not to be a researcher like me, not to be the person who knows it all, but to understand all those links. And in the next session, which we'll be recording, it's part 2, mechanisms and causes. So what are the mechanisms behind it, causes and contributing factors to SIBO? Now, what's really important here is to understand that this information you're exposed to is exclusively in our membership program and on our masterclass programs. Have a look at it, learn it, and it's pretty good. I mean, it's fantastic information. So tell your friends about it, because the more we get in our membership program means the more we can devote to research, which means the more we can add into these programs. And I should make a mention very clearly that the information gets updated every year. So somewhere along the line in the next 12 months, we'll be putting up a Sibo update so everyone can find out what extra information has come out and if there's any really good pearls and gems. So part 2, mechanisms and causes, recorded now.